Plus Moist for Dr. Natsui's Moist Wound Healing. Plus Moist is an innovative dressing based on the theory of wound healing. The product was co-developed by Japanese plastic surgeon Dr. Natsui, a pioneer in wound treatment, and Zuiko Medical Corporation, a pioneer company of absorber manufacturing technology. The creation of Plus Moist is based on Dr. Natsui's moist wound healing, which consists of the following key points. No use of antiseptics or ointments containing antibacterial ingredients on the wound. Stop the wound from drying out, and provide a healing environment that maximizes the body's natural ability to repair itself. How antiseptic damages healthy cell production. Conventionally, antiseptics are used in medicine as a first step in destroying harmful bacteria. However, to understand why Dr. Matsui's moist wound healing avoids this step, we have to take a closer look at what takes place during this process of sterilization. Looking at the structure of both human cells and bacterial cells, at first glance they may seem similar. However, the structure of bacteria is designed to be resistant to outside forces, including antiseptics. Human cells lack this resistance to antiseptic compounds including silver, chlorhexidine, and povidone iodine, so they can easily be destroyed or damaged during the wound sterilization process. This means that during the process of antiseptic use, more human cells are destroyed than the resistant bacteria. When wounded, a clear or slightly yellowish liquid called exudate comes out from the wound surface. This exudate contains various types of cytokines and cell growth factors, and plays an important role to help to control the proliferation and migration of platelets, fibroblasts, and epidermal cells, to name a few. In addition, the exudate contains immune cells such as white blood cells and macrophages to protect against infection. The secretion of exudate keeps the wound surface moist and allows the cells needed to repair the wound to move smoothly, accelerating the healing process. The nerves exposed on the wound surface are covered with exudate and not exposed to air, preventing painful sensations. Therefore, the wound heals with less pain, faster, and cleaner. In most cases, wound healing can be classified into these two patterns. In the event of a shallow wound, in addition to migration and proliferation from the epidermal cells around the wound, epidermal cells also create and proliferate through sweat ducts and pores that are attached to the skin on the wound surface, and the skin regenerates. On the other hand, in the case of deep wounds, the granulation tissue first covers the wound surface, then the epidermal cells around the wound migrate and proliferate, and the wound contracts to regenerate the skin. Plus Moist provides an environment that maximizes human wound healing capabilities. Using Dr. Natsui's moist wound healing, the only required resources necessary for caring to acute or chronic wounds are water and Plus Moist. This makes Plus Moist a versatile and cost-effective product in the patient treatment process. Besides a simple application procedure, Plus Moist has many benefits for both patient and caregiver. When performing wound treatment, not limited to moist wound healing, we have to be careful of the following points. 1. Exudate management, controlling the amount. And 2. Exudate removal. The amount of exudate needs to be properly controlled to create a moist environment that promotes wound healing. Therefore, the amount of exudate should not be too little or too much. If the exudate is too little, the wound surface becomes dry and there are not enough cell growth factors on the wound surface. On the other hand, if the exudate is too much, it causes macerations, exuberant granulation, poor epithelialization, and poor drainage. If the exudate coming out of the wound surface is not properly removed and old exudate accumulates on the wound surface, it becomes a site of infection. Therefore, it is important to maintain the flow of exudate, and excess exudate must be removed without accumulating on the wound surface. Plus Moist contains the following layers. The permeable layer, which includes isolated cell structure and the irreversible membrane. The absorption layer, and the barrier layer. The permeable layer is composed of a unique three-dimensional isolated cell structure and an irreversible membrane. The function of the isolated cell structure contributes to the maintenance of a moist environment and excellent non-adhesiveness to the wound surface. As the wound begins the healing process while covered with Plus Moist, exudate is managed through the isolated cell structure's approximately 20 microliter per centimeter sections. Therefore, even if the exudate is too little, it can be contained in each isolated cell structure and maintain a moist environment. If the exudate is too much, the balanced amount is maintained in the cell, while overflow is contained in the neighboring cells. This prevents excess exudate from contacting healthy skin, preventing irritation. Excess exudate within the cell structure is absorbed through the irreversible membrane, pulling away old exudate from the wound surface while stopping re-entry. Excess exudate should be removed, as accumulation around the wound surface increases infection risk. When the space in the isolated cell structure is filled, the irreversible membrane that constitutes the permeable layer of Plus Moist aids in the flow of excess exudate into the absorption layer. Bacterial growth generally occurs in the absorption layer over time, but this irreversible membrane prevents the exudate containing bacteria from re-entering the wound surface. This technology effectively traps any harmful bacterial elements without access to the wound area, all without the use of silver or antiseptics. Therefore, the isolated cell structure in contact with the wound surface is always filled with fresh exudate produced from the wound surface, so that the optimal wound healing environment can be created. Finally, the last two layers, the absorbent and barrier layers, soak up exudate while protecting the wound from outside exposure and preventing further topical damage, effectively containing and preventing the exudate from soiling clothes during use. Plus Moist can be cut according to the size and shape of a wide range of wounds. This flexibility allows for the application without limiting the motor function of patients. The moist wound healing methodology using Plus Moist is designed to treat a diverse range of medical conditions, regardless of the depth of the wound. In these examples, we can clearly see the progress made before and after treatment in a variety of scenarios. Because of the Plus Moist application features, patients and medical professionals are able to enjoy the benefits of reduced pain and accelerated healing that only Plus Moist can offer. All wound treatments can be completed with the Plus Moist series alone. In review, the moist wound healing methodology keeps the moisture levels of wounds in optimal healing condition, controls the amount of exudate through its exudate management function, can relieve pain, provides an almost painless experience during dressing changes, does not stick to the wound, reducing repeat trauma, prevents contaminated exudate from re-entering the wound, provides excellent absorption of exudate, prevents exudate overflowing onto and irritating healthy skin, greatly reduces development of rashes and macerations, eliminates the development of uncomfortable and scarring scabs, is designed to be chemically, including antiseptic free, and is economically advantageous through its easily customizable fitting for wounds, reducing waste. Plus Moist for Dr. Natsui's Moist Wound Healing.